temporal lobe, sometimes known as the neocortex, is part of the cerebral cortex, which also includes the occipital, parietal, and frontal lobes. It is situated in the middle cranial fossa, anterior to the occipital and posterior to the frontal lobes. It is inferior to the lateral fissure and separated into superior, middle, and inferior temporal lobes. To completely comprehend the temporal lobe, it is necessary to examine it through functional connectivity rather than physical structure. According to localizationalism, distinct brain areas execute certain functions but are defined by their connections. Comprehending function is critical to comprehending structural relationships. The Human Connectome Project revealed 180 parcellations of the human cortex, 23 of which were preserved and the remainder reinterpreted or dissected into particular areas. The temporal lobe, which was formerly separated by Brodmann's regions, has been reorganized into a new scheme due to lack of information of its functional or organizational anatomy. The uncinate fasciculus, inferior longitudinal fasciculus, inferior fronto-occipital fasciculus, middle longitudinal fasciculus, arcuate fasciculus, and two primary commissural fibers were found to represent major association fiber pathways. Functional MRI revealed 8 cognitive domains related to the temporal lobe, namely speech perception, speech production, hearing, episodic memory, phonological structures, semantics, social areas, and images. These regions are linked to the posterior, superior temporal gyrus, medial structures, and the rest of the temporal lobe. The temporo-occipital junction is an important location in the temporal lobe. The Human Connectome Project suggests a novel system for the brain's functional connections, divided into 4 areas: lateral for semantic processing, the pole for emotional processing, the inferior for visual processing, and the medial for memory and visuospatial processing. The scheme divides association cortices and auditory regions 4 and 5, and temporal region A in the superior temporal gyrus into the insular and opercular cortex. The temporal lobe receives oxygenated blood from the internal carotid system and the vertebrobasilar arteries. The anterior choroidal and middle cerebral arteries supply the uncus, amygdala, and parahippocampal gyrus respectively. The vertebrobasilar system supplies the inferior surface of the temporal lobe, and blood drains from the temporal lobe via 2 main routes: the superficial middle cerebral vein and the posterior choroidal vein. The temporal lobe is essential for memory, language, and emotional processing. It is commonly used to treat temporal lobe epilepsy, which occurs when patients have seizures that originate in the temporal lobe. Despite the risks, surgery is frequently used to eliminate or considerably reduce seizures in over 80% of patients. WADA tests, functional MRI imaging, and cognitive exams all help to reduce the risks associated with treatment. A study of 215 individuals who underwent temporal lobe surgery found that 89% were seizure-free or had lower than average number of seizures, with no postoperative deaths. However, there is no consensus on the optimal surgical strategy, and the technique chosen is up to the surgeon. In refractory temporal epilepsy, selective transcortical amygdalohippocampectomy should be investigated as a therapeutic option.